I am Dr. Sanjay Dhawan. Today I'll talk to you about problems that happen during the summers and monsoon months. Indian summer is iconic, and so are the Indian monsoons. Monsoons bring with them a relief from the heat of the summer, but they also bring a lot of problems, especially when the eyes are concerned. So what are the problems that are common in eyes during summers and monsoon? Eye allergies become more common in summers and monsoon. Eye infections of various kinds, the so-called conjunctivitis, are very common, and we often see outbreaks or epidemics of conjunctivitis in these months. Dry eyes, stye, and other infections of the eyelids, spring catarrh, trachoma, swimming-related conjunctivitis and infection. What is conjunctivitis? Conjunctivitis is basically an inflammation of the surface layer of the eye. The eyes become red, there is irritation, there is itching, there is watering, there may be various kinds of discharge in conjunctivitis. There can also be swelling in and around the eyes, swelling of the lids. Conjunctivitis is of various kinds. The most commonly known and understood conjunctivitis is due to infection, and again of two main types. First one is the viral infection. So when you get these outbreaks of red eyes and conjunctivitis, which spread from person to person and which is very common in summer and monsoon months, this is basically a viral conjunctivitis, and the most common virus which is a culprit is adenovirus. The second common cause of conjunctivitis is a bacterial infection, which can happen because of poor hygiene. Other type of infection like trachoma, chlamydia, inclusion conjunctivitis are also seen, and they may happen in relation with, say, swimming pool. Yet another type of conjunctivitis is the allergic conjunctivitis. What are the signs and symptoms of conjunctivitis? The first thing that you notice in your eyes is redness, associated with irritation, itching, mild discomfort, watering from the eyes. There may or may not be pain. There may or may not be swelling in and around the eyes. You may even experience a bit of a photophobia, that you find it difficult to open the eyes in bright light, and you may resent light. There may be a watery discharge. There may be a pus-like or purulent discharge. There can be even a stringy or white mucus discharge, depending on the cause of the conjunctivitis. Ideally, you should consult an eye specialist or an eye surgeon, which are also called ophthalmologist. However, for simple outbreaks, simple conjunctivitis, one can start some treatment on their own. What you can do on your own is wash your eyes with clean, cold water, but this washing should not be done more than twice in a day. You can apply some ice packs to give you relief from irritation and swelling. Ice packs can be taken in a steel tumbler or in a handkerchief and applied to the closed eyelid. You should also make sure that you take a few precautions to prevent spread of infection from one person to the other. This infection usually spreads by direct or indirect contact, so avoid handshake. Make sure that you don't share your toiletries, handkerchief, towel, etc. Whenever you are touching your eyes, or if anybody else is helping you take care of your eyes, then soon after the eye care, the hands should be sanitized, preferably washed with water and soap, or you could use an alcohol-based hand sanitizer. Use fresh tissue papers to wipe your eye and discard the tissue paper after using it. The infection does not spread by looking at anybody's eyes, nor will it be prevented by using sunglasses. Sunglasses will only give you some relief when you go out in the sun. It is also transmitted through air and water and toiletry or use of contaminated eye makeup. So one has to be very careful in using these things. What are the other things that one should take care of during the periods of eye infection? Number one, if you are a user of contact lenses, just stop using contact lenses. just discontinue that. You should also avoid going to swimming pools or swimming during periods of infection. You should avoid exposure to bright sunlight, fumes, chemicals and heat. You should also avoid going to crowded places during epidemics. Viral conjunctivitis is usually a self-limiting disease. It may take 1 to 2 weeks for complete recovery. And most of the time it does not need any medication. However, to prevent a superarid bacterial infection, mild antibiotics can be used, for example chloramphenicol. Along with viral conjunctivitis, you may also experience cough, cold, upper respiratory infection and some bit of malaise, weakness, headaches and fever. It's all part of the viral symptom. Allergic conjunctivitis. The hallmark sign of allergic conjunctivitis is intense itching. Intense itching in the eye happens on exposure to the agent that may cause allergy. For example, people who have got allergy to pollen or dust, when they are exposed to outdoors to wind which has got pollen in it, they experience certain bout of itching in the eyes. And this happens in both the eyes together. They may even experience cough and sneezing and cold along with it, because again the allergy may affect the nose as well. So what do? We can use cold compresses to take care of intense itching and discomfort in the eye, and we can use anti-allergic eye drops or anti-allergic oral medication, but these should be taken after consulting a qualified ophthalmologist. We can take steps to avoid exposure to the agents that incite allergy, or what are called allergens. Dry eye is a condition where the tear film of the eye gets disturbed, and it leads to formation of dry spots on the eye which may cause irritation, redness, discomfort and surprisingly watering from the eyes. So dry eye does not mean that there is a lack of water or there is a lack of tear, but there is an instability or abnormality of the tear film. There are two types of dry eye on the whole. First type, or the so-called true dry eye, is when one of the tear film elements is inadequate or abnormal. So it is an inherent dry eye, which is more common with older age, more common in females than males, and may also be associated with some form of other diseases and hormonal disturbances. The second type is the situational dry eye, which most of us experience when we work for long hours on the computers. What happens is that when we're looking at screens or watching TV or reading, we don't blink as frequently as we normally do, as a result of which the tear film evaporates more than usual, leading to formation of dry spots, and that may cause the temporary or situational dry eye. This type of dry eye can be prevented by consciously blinking more often, taking frequent breaks and frequent rests. Whereas the type of dry eye where there is a deficiency of a tear film element. Now tear film has got 3 layers, and any of the 3-layer elements may be deficient or abnormal. So it requires a proper investigation and proper treatment. The commonest form of treatment is tear substitutes, or the so-called lubricant eye drops, which can even be had over the counter, and one could safely use them 2 to 4 times a day. However, it is best to consult an ophthalmologist and take proper treatment from there. What's a stye? The eyelids alongside the eyelashes have got a whole row of 2 types of glands. The first type is the sweat gland and the second type is the oil gland. When an infection happens in one of these sweat glands, it forms a small pimple or a boil with a pus point. It is usually red, swollen and painful. This is what is called stye. Infection may also involve the oil gland. However, the swelling is a little deeper, the pain is somewhat more, and you may or may not notice this pus point in these cases. This we call technically a hordeolum. However, commonly this also is called a stye. we need a systemic or oral antibiotics for that. So you should consult an ophthalmologist or your eye specialist for the treatment. He may prescribe you oral antibiotics. He may also prescribe you oral painkillers and anti-inflammatory tablets. He may also advise you to put some antibiotic eye drops and do some hot fomentation of the eye. This condition usually lasts a few days to 1 to 2 weeks time, and most of the cases recover completely. However, in some cases, which we call a deeper form of stye or hordeolum, where the oil gland is involved, the opening of the oil gland may get clogged and oily secretions collect inside. They may get dried up and form a small lump, which is called a chalazion. Most cases of chalazion do not respond on their own or to any medication and may require a removal by a small procedure, which is called incision and curettage. This procedure is done from the inside of the lid, where a small nick is given in the lid and that nodule or the lump is removed. It's a very simple, safe and painless procedure, may require local anesthesia. You may have to patch the eye for a few hours and you can resume your work back the next day. Cornea is the black portion of the eye, the black round portion of the eye. Sometimes a scratch may develop on this cornea. This scratch or abrasion can get infected by bacteria, virus or fungus. This infection can start eroding onto the surface of the cornea, sloughing off the superficial layer and the deeper layers, forming a sort of a crater with infection. This crater formation due to infection is called corneal ulcer. This is a much more serious and severe form of a disease and should not be ignored at any cost. And no self-medication, no self-treatment. I would say that even if you suspect corneal ulcer, you should immediately rush to your eye specialist for a proper treatment. The treatment for the corneal ulcer is in the form of antibiotic eye drops and other medication. The treatment is usually a prolonged one. It may take weeks to months for complete recovery, and very often than not, the corneal ulcer leaves behind a scar which may actually affect your vision to a great extent. So don't ignore corneal ulcer at any cost. In a nutshell, you must take good care of your eyes in the summer and monsoon months. If you face any difficulty, any problem, please don't ignore it and consult an ophthalmologist at the earliest. Thank you.